Hello everyone, welcome to this webcast of the International Dermoscopy Society. My name is Todorovska. I will speak about the shiny white structures and associated diagnosis. They were firstly described by Professor Ash Margop in 2009, just a few years after the introduction of polarized dermoscopy, because these bright white structures can be seen only under polarized light, an optic phenomenon due to the birefringent properties of the collagen bundles. Histologically, they correlate to dermal fibrosis or keratinization in adnexal openings. Shiny white structures can be present as lines or streaks, blotches and strands, or as rosettes. Let's start with the shiny white lines or streaks, formerly known as crystalline or chrysalis structures, oriented orthogonally, parallel or perpendicularly to each other, a confirmed sign of malignancy, highly specific for melanoma. But they can appear in benign lesions too, and here are the exceptions. Dermatofibroma is the most frequent lesion we see in our daily practice. On non-polarized light, a typical white scar-like area shows shiny white lines under polarization. The spitz nevus, non-pigmented, displaying characteristic dotted vessels and shiny white lines, short and perpendicular to each other, also seen in the pigmented variant, as in this example, mainly centrally located and parallelly oriented. Special site nevi, like genital and scalp nevi, also may display shiny white lines. We must have in mind the clinical and epidemiological data, and when no additional melanoma clues are present, favor monitoring over unnecessary excision in such a delicate location. Since trauma and subsequential fibrosis can happen to every type of lesion, shiny white lines can also be observed in traumatized seborrheic keratosis or traumatized intradermal nevus. The presence of shiny white lines in scars is also noted due to the fibrosis and collagen remodeling as the main process in their development. Lichen planus-like keratosis is a real diagnostic pitfall. It may show shiny white lines and other clues for melanoma, like gray dots and many colors, and it's usually confirmed after excisional biopsy to exclude melanoma. And the great imitator, the eccrine poroma, which can mimic everything including shiny white lines. The histological background of the shiny white lines in melanoma is dermal fibrosis. The extent of dermal fibrosis correlates with Breslow thickness. In practice, the more white shiny lines you see, the thicker the melanoma. Like this first case showing a diffuse presence of an abundance of white shiny lines has a Breslow of 1.1 mm, while the second one is only 0.3 mm thin. There is a significant correlation between the presence of shiny white lines and increased depth of invasion. They are more commonly found in invasive melanoma, in 41%, than among in situ, only 70% of melanomas. And this is such a case, showing white shiny lines, although still in situ, probably due to solar elastosis and regression on the background of an extensive photodamaged skin. In melanoma, shiny white lines are usually short and perpendicular to each other. They can be distributed in different patterns, like here centrally located, or at the periphery, radially arranged as in this spitzoid melanoma. Symmetrically distributed, almost forming a network over this nevus-like nodular melanoma. Remember why shiny lines are not expected in a nevus. Short and perpendicular at the periphery, and broader and wider at the center at the thickest, most invasive part of melanoma, or completely irregular with some bluish hue, as in this thick nevoid melanoma simulating melanoacanthoma. In this case, they are only focally present. No matter their distribution, the most important feature of the white shiny lines is that they are angle dependent. So always rotate your dermatoscope. Only then you can see how they are appearing and disappearing under different angles. If you do not rotate, you may miss this valuable clue to malignancy. Rosettes, or four white dots in a four clover-like arrangement, they are an optical effect under polarization of keratin in the adnexal openings, producing small, or concentric perifollicular fibrosis, producing large rosettes. Previously associated only with actinic keratosis and squamous cell carcinoma, now we know they can be found in many inflammatory lesions, benign and malignant tumors, even non-lesional actinically damaged skin. Here is the typical actinic keratosis showing wide and wide follicular openings and rosettes. Here seen even more clearly and in abundance. They are found in many inflammatory lesions like in this eruptive lichen planus, lichen sclerosus and atrophicus, both genital and extragenital type, in molluscum contagiosum, discoid lupus erythematosus, the late stages, recently described also in T-cell pseudolymphoma, and even in malignant tumors like this BCC and melanoma. Shiny white blotches and strains. Those are white patches or linear white areas, mainly seen in BCC, but also in other malignancies like SCC, MCC, and melanoma too. Histologically correlate with the stromal alteration of the tumor. Here is an squamous cell carcinoma, moderately differentiated. Most common findings in BCC, in fact, the combined presence of shiny white blotches and strains is associated with high diagnostic specificity for non-pigmented BCC, both nodular and superficial variant as in these examples. We can see them also in pigmented superficial BCC and pigmented nodular types too, even in Merkel cell carcinoma. So, polarized dermoscopy and shiny white structures are valuable diagnostic tools, extremely helpful in distinguishing equivocal lesions, like in these two pink nodules on dermoscopy, both showing arborizing vessels over pink whitish background, but under polarization, only the malignant one, the BCC, displays these shiny white structures. Toggling between lights will make shiny white structures more easily recognized and enhance our diagnostic accuracy. Another example of clinically similar lesions on the same location, both sharply demarcated, uniform in color, palpable shiny papules. The one on the left, under dermoscopy, an innocent seborrheic keratosis, but the other one, an invasive thick melanoma, discovered thanks to the white shiny line, the polarized dermoscopy. These shiny white structures can be sometimes the only clue to malignancy, helping us raise the awareness in cases of doubt or featureless lesions like this amelanotic melanoma. In conclusion, shiny white structures are associated with a variety of diagnoses, neoplastic, both malignant and benign, but also inflammatory. Observed in melanocytic lesions are highly specific for melanoma, and like any other dermatoscopic clues, should be interpreted in the context of other dermatoscopic structures, the overall pattern, and the clinical scenario. And nota bene, some of the devices may not show these important polarized specific clues to malignancy. My take-home message is for you to choose wisely your dermatoscope. Always use polarized dermoscopy. Toggle between lights and rotate. Never mind the rosettes, but be aware of the shiny white lines and strains. Thank you for your attention. I hope you found it interesting and useful for your daily practice.